The coronavirus pandemic has now cost more than 100,000 lives in Germany. The number of infections keeps rising, raising fears the worst is yet to come.
Not since the Second World War has Germany faced a challenge that so much depends on our universal solidarity.
As Germany faces a deadly fourth wave, new restrictions and lockdowns may be on their way to keep more lives from being lost. Hello and welcome to your COVID-19 special. I'm Chris Kober in Berlin. With infection rates higher than ever and a growing number of hospitals at breaking point, the German Air Force has been airlifting ICU patients to regions with free beds. Many others are meanwhile grieving over the lives that the pandemic has already taken in Germany. DW reporter Luisa von Richthofen spoke to one woman who is mourning two close relatives.
My father was a fun-loving man, very cheerful and lively. He didn't let anything get him down. He was not ready to go. Even on the day that I visited him at the ICU, I felt his love of life.
Kerstin Fleischer's father passed away almost a year ago. And that was the second heartbreaking moment for her and her family. Only a few days before, her father-in-law had passed away too. He was also a victim of COVID-19. During that time, the entire family was infected with the coronavirus. Today, Kerstin Fleischer still wonders how she found the strength to get through those fateful weeks.
We were all in quarantine when my father died, and that was horrible. I could only talk to my mother over the phone or leave her voice messages. Each and every one of us suffered. After my father died, I was not allowed to see him. His body was taken directly from the hospital to the crematorium, and I miss that. It is such an important part of mourning. I still feel I need to see him in order to fully understand why he had to die this way. I am literally missing the stage of the grief process.
It's not like Fleischer was a stranger to mourning. It's actually her job. She is a grief counselor. And more people whose relatives have died from COVID-19 are coming to her.
I think going through this myself has made me more sensitive to what others are going through. I can say, I feel for you and really mean it. I have a deeper empathy when I hear their stories.
She has experienced firsthand much of what these people are going through. Many feel guilty because they could not be there in person while their loved ones were suffering.
It is very important to me to see more than just the final moments of death. Instead, I want to remember their whole life story, my connection to my father and father-in-law, and think about our relationship. What memories do I have? What was special? And I try to communicate this way of dealing with grief to those I comfort as well.
She still can't fathom the fact that hundreds of people in Germany die of COVID-19 every day.
You experience your own life in a different way when you realize that other people are going through the same things as you are. So many people are losing their loved ones, and you have to ask yourself, does it have to be this way? And I am worried when I think about this. I hope that every individual will also take responsibility for society as a whole, that they will act responsibly so that we can fight against the fourth wave and get control of the situation.
The pandemic is a long way from being over. So far, more than 100,000 people have died in Germany, but the number of people who live in grief goes uncounted.
Let's take a closer look at this figure and what it means with Tobias Kurt, director of the Institute of Public Health at Berlin's Charité Hospital. Welcome to the program. 100,000 COVID-19 deaths in Germany. What does this number tell us when it comes to the country's approach to the pandemic?
Well, first of all, it's a symbolic number. And as we just heard, behind every case, there are families, there are friends who are suffering. It should remind us how deadly this virus can be and is, and it should remind us that we definitely have to take measures to really prevent future deaths from this disease.
And if we put this number into an international context, where does Germany find itself there?
I think it's very difficult to compare countries as there are cultural differences in availability of vaccines, vaccine rates, etc. It's definitely too high, and we really need to understand how serious this disease is.
Now, obviously, a medical crisis of these proportions will cause suffering and will have victims. Nevertheless, how many of these 100,000 deaths would have been avoidable?
It's a good question. It's very difficult to precisely estimate. Many of those certainly could have been avoided, specifically after we had vaccinations. And now the real issue is that we should understand that we can avoid future deaths if we pick up the vaccination rate, if we take some measures to really get the numbers down, because many more, unfortunately, will die in the future.
Germany does have a vaccination rate below 70%, below the EU average. That certainly seems to play a role here. Now, let's look at the current situation. Much is not yet clear when it comes to the newly discovered Omicron variant. How do you expect it to impact the course of the pandemic in this country?
It's very difficult to estimate at this point, as we do not have all the numbers that we need to make proper estimation. Certainly, it's of concern, in particular, if you have a situation right now where you have high number of new cases every day, where the hospitals are full and the society is really on its edge. So we need to make sure that the numbers are going down now, should Omicron really have the impact that we all fear.
When the Delta variant first was discovered, there were experts saying, well, it might be more infectious, but less lethal. Is that something that could apply to the Omicron variant as well?
I think this is speculation right now. We know for sure Omicron is here in Germany already, probably has been here for several weeks. And there's a certain concern that this variant will take over as Delta took over a few months ago. Whether this is more severe or more deadly is something that we need to carefully evaluate.
When the World Health Organization warns that Omicron may have a high likelihood of immune escape from antibody-mediated protection, what does that mean?
It means that the vaccines may not be as effective as against the Delta variant or the wild variant that we had in the beginning. So we definitely need to make sure that we understand that these may come up. We need to get vaccinated. We need to get the booster shots. It's really important now to watch the situation and to collect data to then make proper consequences on the population level.
Tobias, as people are arriving on flights from South Africa and neighboring countries and they're sent to quarantine because of the Omicron variant, what progress have we made when it comes to containing the virus through such surveillance?
I think, first of all, it's important that this is not a South African problem. South Africa was able to detect this variant and shows the really good surveillance system that they have. Omicron certainly is in other regions of the world already, but also it shows that the international community has learned and has taken action quickly to really react to this. Whether the action is enough or proper is something that we have to evaluate daily, to not making these regions in the world, or specifically South Africa, suffering more than necessary.
Now, if we look at the situation here in Germany, there are some experts saying that another 100,000 people will die of COVID-19 in Germany before this whole pandemic will be over. You yourself are skeptical as well. How reliable is such a figure, and what does it depend on not to happen, for that matter?
Well, those figures come from mathematical models that project into the future. Those models depend strongly on assumptions. So if we all get vaccinated, if we all get a booster shot, and in the future there will be modified vaccinations available, this number hopefully will not be reality. However, there are certain scenarios where this number may in fact be reality. So we definitely have to be on alert and evaluate the situation very carefully today and in the future.
Tobias Kort, Director of the Institute of Public Health at Berlin's Charité Hospital. Thank you for talking to us.
Thank you for having me.
Dying of COVID-19 has been the sad fate of millions of people around the world, but many more have fallen ill and survived. And that is one issue that one of your questions for our science correspondent Derek Williams touches on.
What's the survival rate of COVID-19? How is it calculated?
Scientists who work with data on mortality rates related to COVID-19, they generally don't use the term survival rate, although it is a common one in evaluating other diseases like cancer. For example, according to cancer.net, the 5-year survival rate for pancreatic cancer is 10%. That's the percentage of people who are diagnosed with it who are still living at the end of those 5 years. But epidemiologists dealing with a pandemic disease where large numbers of people also recover, they generally talk instead about other numbers, especially what's called the case fatality rate, or the CFR. Now, it's calculated by dividing the number of confirmed deaths from the disease by the number of people diagnosed with it by a test, so clear background numbers. As this graphic from Our World in Data shows, CFRs have generally fallen in most countries over time from the early days of the pandemic. That mostly reflects the fact that doctors have gotten a lot better at treating the disease since it first appeared. In Germany, this credible source says that at the moment, the CFR is around 1.8%. Now, that doesn't sound like much, but think about it for a second. If correct, it means COVID-19 is currently killing about 18 out of every 1,000 people diagnosed with it here, which makes it about 10 times more lethal than seasonal flu. And when you have tens of thousands of people being newly diagnosed every day, like at the moment in Germany, the numbers of those dying from it will start to add up very fast, very soon. Of course, most people who get the disease will survive it, but that's also highly dependent, the experts say, on factors like your own personal age and your health and whether you've been vaccinated. So talking about general survival rates and trying to apply the concept to predict your own chances of survival if you're infected doesn't really make sense.